Part of overcoming mental health issues is having the right provider. The three of us are going to be talking about what effective mental health treatment looks like, so stay tuned.
Hi guys, this is Real Talk Mental Health, where we talk about real life mental health issues from the provider's perspective. That's us. I'm Julia Swafford, this is Brendan Rowe, this is Piper Bursmeyer, and we're gonna have a conversation today about effective mental health, what you can expect, what you should be looking for, insider tips to make sure that you are receiving care from a top-notch facility, that you have a really good provider, and that you can be confident that you're receiving the best care. This is super important that we're asking these questions, that we're talking about this when it comes to your treatment, because without this, treatment can draw on and on for years and years unless you have a really good provider who's well informed, who's willing and knowledgeable to give you a variety of treatment options. And we want to talk about what that might look like in your care. So let's start with your primary care provider. Primary care providers are wonderful. Their whole job is to be able to be knowledgeable about a breadth of issues, to be able to go, a couple of steps into almost every health problem that exists, and to be able to get you started. Primary care providers are very busy. They see a lot of patients and they don't always have a lot of time with you, and that's okay for what primary care providers are offering to you. So timing, in my opinion, is not really the issue. It's more about how do they use that time? Are they using that time efficiently? And are they showing you some time in that sometimes 10-minute time period that they really care about you, that they really see you as a person? Another sign that you have a good primary care provider is somebody who knows when to refer and consult. So if you have a primary care provider who has tried one or two options, and here we're talking about mental health, so I'm going to kind of move in that direction, but a primary care provider should be able to treat a basic mental health condition, depression and anxiety disorder, maybe trying one or two medications, but then the primary care provider should know when to refer you out. If you have severe symptoms, hard to treat symptoms, if you have a very complex history or a complex diagnostic profile, multiple complicated diagnoses, a primary care provider should at that point be referring you out to either a psychiatric prescribing specialist like a psychiatric nurse practitioner or psychiatrist for your medication management, and also helping you get connected with a really good therapist. So Brendan's going to talk a little bit about what that might look like.
Right, so therapy is key to overcoming mental illness. Actually, studies show that a combination of therapy and medication has the best outcomes, when we compare it to someone who just does medication alone or therapy alone. So, I think it's important to stick with an evidence-based psychotherapy initially. So what I mean by that is cognitive behavioral therapy, for anxiety or depression, dialectical behavioral therapy, EMDR or psychodynamic therapy. These are all evidence-based. In other words, there's research data to support their use in that disorder. When finding a therapist, it can be challenging. So I think it's important to reach out to people you trust. So a family member, a friend, someone you can confide in who may have experienced therapy and has a good recommendation. It's also a good idea to maybe consult with your primary care physician, or if you already have a psychiatric provider, like a medical provider, like a psych nurse practitioner or psychiatrist, they might have therapists to refer you to as well. I always tell my clients to look at online resources like Psychology Today, because that website is really great in allowing you to narrow down therapists by their specialty. So if you're looking for someone to manage your depression or anxiety, you can narrow down your search by that. You can also narrow down your search by education level or location. Mm-hmm. So I think that's a great place to start.
Because convenience is key.
Yeah, and so once you've identified or narrowed down a few options, I think another good option is to check to see if the therapist offers a free phone consult. Most providers do. You can take 10 or 15 minutes, chat with them, see if it's a good fit, if they have experience in what you're dealing with. And then, I recommend, calling at least 3 providers and then making a decision based on those 3 conversations. I think that's a great place to start.
Having a good connection with your therapist is really important. If you feel like you don't have that connection, even if you feel like you're working with a therapist who seems to be skilled, that's okay. And in fact, it's something you should talk about with that therapist. Therapists are used to hearing that. They are able and willing to refer you to somebody else if you're feeling like that connection is just not there. It won't hurt anybody's feelings.
And at the core of the connection, you want to make sure that you feel safe. It's a safe place to open up. You don't feel judged, and there's some connection.
Yeah. Let's shift gears and talk about the psychiatric providers who might be prescribing medications.
Yeah, so specialists. So, what I'd like to talk about today is, when you seek out medications, whether it be from a psychiatrist or a psychiatric mental health nurse practitioner, I want to first and foremost say that when we are talking about these opinions, of course, this is reflective of our own personal experience, professional experience, and that we are very well aware that, most providers that go into our field have good intention. They mean well, they want to do well. But not all of us are created equal. We have different strengths and weaknesses and different skill sets and different training, and that can come out on how we perform. So we're going to kind of talk about some things you're going to look for kind of your top-notch, highest performing provider, and hopefully this is helpful. So one of the first things that I want to talk about is efficiency and technology. So this has become extremely important in COVID times with telemedicine, making sure that they have a platform that's not dropping calls, that they know how to use, and hopefully they're using an EHR by now, it's electronic health record. These are really efficient. You get to fill out paperwork prior to your visit using evidence-based measures, which is able to measure your symptomology. So when you're showing up to that appointment, your provider isn't flying blind. They kind of know what they're already dealing with and they can measure. Other forms of technology can be using an application for phones, not the archaic landline, but there's secure HIPAA compliant phone systems that allow text messaging even, and voicemails and tracking, and voice transcription, and it's incredibly useful. We just changed our own phone system within our company, and it's just, I feel like our quality of care has just skyrocketed because of that. So technology is really, really key, and technology costs money, and finding a provider who's willing to spend that money to serve their clients that high capacity is really important.
One of the things to think about when we're evaluating your provider and knowing that you're getting good care is how are your appointments run? How are they scheduled? To start, your intake, your very first diagnostic evaluation with a psychiatric prescriber should be at least 40 minutes. That's bare minimum, guys. Usually it's an hour, sometimes it might run a little longer, and your follow-up should at least be 20 minutes, unless you're really, really stable and we're just doing refills. At that intake, the prescriber should be organized. They should be able to lead that appointment, asking really good questions and taking a really good and detailed history so we're not missing anything. The measures that we talked about, evidence-based measures, that would be a really important thing, especially on intake, but also on follow-up, to make sure that we're not just winging it, that we're actually using the science and the evidence base to make these diagnoses. Accessibility. Is this person accessible to you in between visits? Of course, we have boundaries, and return phone calls and emails might be 24 to 48 hours, but if somebody is making a medication change, they should be scheduling a follow-up that makes sense, and then be accessible to you in the meantime. On the other side of that, if you're very stable, if we are not anticipating any medication changes, the person doesn't need to oversee you. That's just not necessary when medications are stable. You can be seen every 3, sometimes even every 6 months. That makes more sense in that way.
Yeah, absolutely. It's really good feedback. Another thing that I think we really want to talk about is just the topic of being patient-centered. It's so broad, but what I mean by that, I'll give you kind of a couple examples. So when we do our job, which is quite complex, when we make decisions, so when you have a top-notch provider, they're going to do things that may not make their job easier, actually, that may make their job harder. So a couple of good examples. We use a lot of e-prescribing, which is electronic, which is great, but there's ways to prescribe that are more efficient and effective for you. So if we want to, taper up a medication, or we're trying to accomplish something, we can if you have a provider that's writing 2 separate prescriptions, that's going to cost you 2 copays. So you need a provider who's knowledgeable on how to write the prescription to help, fit your budget. Taking costs in consideration. We're not just willy-nilly prescribing meds that are not even feasible for you. We're making sure that we're asking those questions of you, but also, bringing up the information about brand name medications if we truly feel like that's the direction that we should take, because not every med's created equal. And you need a provider who's knowledgeable about new medications, but also knows how to use them in a way and maximize dosing, especially when it's very, very expensive.
It's an art.
It is. I mean, there's so much science to what we do, but there's a lot of art. And, being open to information, pharmaceutical reps can have a lot of bad reputations, but in fact, they can be a really great tool for providers. We have samples that help us, you try something to make sure it's a good fit before you drop that money. And coupons and knowing how to use programs, being aware of patient assistance programs. I mean, these are things that take time out of our day, but that's a top-notch provider who goes over and above to do so, because prior authorizations are a pain, honestly. It's much easier to do generic medications, but that's not patient-centered.
Yeah, or to keep the med regimen the same every single time, and not take that time when you're saying this isn't working for me. Say, okay, it looks like we need to make a change. Let's talk about our options.
Yeah, I think that's a really amazing topic within itself, because it's really easy to say, let's watch this and see you in a month. But, if you're on a medication that is really not meant to be long-term, and in particular, this would be benzodiazepines, your Xanaxes and lorazepam, Ativans, Valiums, all those words that you've heard with benzos, they're really challenging to taper off of. But, majority of providers understand that people should not be on these long-term unless there's very specific reasons. But it's hard on us and it's hard on you, but we know that's what we need to have happen. And that is a top-notch provider who guides you and supports you in that process, and doesn't just let you go 5 years down the road being on a benzo and having cognitive issues. Using mail order, getting you on mail order, where if you're seen every 3 months, like you talked about, that we're taking advantage of mail order, because oftentimes you save a whole copay, and learning how to convert you over to mail order, making sure you even have that benefit. That's a really wonderful tool that's patient-centered, because it really benefits you. I think it's important that providers stay up to date, that they're aware of alternative treatments, newer ideas, whether it be medications, Spravato, TMS, psychedelics, different types of therapy, EMDR. You want a provider who is thirsty for knowledge, and most of us are. And frankly, we would probably like more time for continuing education, but when they don't know or they're getting stuck, that they're willing to consult and they're willing to refer, that they can put their ego aside and they can have relationships within the community and talk about a challenging case and to get help. We love doing that.
And on that there's ongoing coordination of care, that your psychiatric provider is willing to talk to your therapist, to talk to your primary care provider, that they're not this lone island.
Yeah, absolutely. So, I think that, bottom line, we want to, this is best case scenario, right? And we have to be realistic that, unfortunately, the mental health field is just not where we need it to be in terms of accessibility of how many providers are here. It's actively changing. We're hoping it improves, but there's definitely some limitations, and we don't want you to feel that you're less than or you're not able to get as great of care if you don't meet all of these check boxes, right? Sometimes you might just have to decide what's your highest priority and what you're willing to compromise on, and maybe not. And also, shopping around and finding a different provider that works well for you, and being confident and okay to ask those hard questions or ask for improvement from your provider, because we really should all have room for growth, and we all should be able to meet our clients where they're at.
Absolutely.
So we really hope that you enjoyed this piece, and we plan on diving more into these topics even further. And in particular, one of a special place in our heart is really talking about what makes a really effective, efficient TMS clinic, and we're looking forward to that episode. So stay tuned to that.
Yeah, that's interesting content to you guys. Go ahead and click that subscribe button, the notification button, so you know when we come out with new videos. We hope this is useful to you guys. Thanks.